Welcome to NDTR Spotlight, the corner of the internet where NDTRs shine. I'm your host, Marie Lorraine, and today we have a guest who's been at NDTR since 2005, so definitely lots of experience. She has her Bachelor's of Science in General Dietetics with a minor in Health and Biology, and she's worked in almost every category, every field, or every area that you can work on as a DTR, and is currently working as a private practice nutritionist and public health nutritionist. So do yourself a favor and definitely listen to this podcast, because I think there's going to be a wealth of knowledge that just comes with working in the field for an extended period of time. So LaVonda, thank you so much for being here.
Hello. I've been looking forward to this.
Me too. So how did you find out about the NDTR credential back in 2005?
Well, when I graduated from college, I was a public health nutritionist for a while. I went up to a nutritionist 1 and then a nutritionist 2, where you do WIC and outpatient services with public health. And I had my child and I stayed out for a while. And I thought, I want to do something else. I don't want to be limited to just public health. And that's when I went to the ADA, who I've been a member with forever. And I found out about Penn State's distant program where I could do the work online and have a preceptor at a local hospital, a dietitian who interns me and puts me through the rotations. And that was about, I think, 6 or 7 months. And it was very good training. And I think it does help with the internship, with the taking the exam. So that's how I got there.
That's very interesting. So you didn't need to be a DTR to work in public health. So what was the attraction to getting that extra credential?
Well, I thought about going to getting my RD, but I thought I didn't really want to do a lot of high risk patients. My goal was fitness, wellness, diabetes, weight loss, and just general health. Nothing like renal or, a burn unit or cancer. It was just like, that's not where I wanted to be. I wanted to be with people, helping people personalize their nutrition plans.
Wow, that is so refreshing and wise, because usually people just go right to the dietitian credential just because it's a wider scope. But everything you said about not wanting to do high risk patients is allowed for the DTR. So that's really cool that you were able to identify that and then pursue that DTR credential. So what was the internship like and studying for the exam like for you back then?
Internship was great because my public health nutrition director sent a letter to the chair of it in Penn State and told her exactly what my strengths were and what my weaknesses were. And that is what that dietitian focused on: the G tubes, the J tubes, not the failure to thrive babies, not the gestational diabetes, the stuff I didn't have a lot of. And they really narrowed in on that. And I think that helped, like I said, with the exam and helped further my knowledge clinically to be a better NDTR.
Yeah. So it sounds like it just kind of shaped you to be more well-rounded. If that's
yes, and they did a super job. Super job.
Do you know if that program is still around at Penn State?
I do not know, because you can just graduate now and take the exam and get it. So I do not know. It probably is not, I wouldn't think, but I don't know. There's a certain amount of advantages to me being in the hospital. I think it was just a valued experience, and it does give me an idea of what, I went on to work clinical dietetics. So it definitely gave me a leg up with that, I would think.
Yeah. Internships are definitely very beneficial. So after you got your DTR credential, what was your career? What job? How was that job search? And what was the first job you landed as a DTR?
Well, actually, it was going to be the hospital that I was working with, but I had a sudden move because of my husband's job, and we had to move to another in our still same state, but another area. So as soon as I got the credential, we moved. And I felt so bad because I'd been on the board of dietetics for the state. Been trying to make inroads with NDTRs because they were not big. I think the exact count of my state was 40 at the time, and no schools that did it, none, zero, zip.
And that was
So
Pennsylvania, right? Was
yeah,
Pennsylvania? It's a big
no,
state.
no.
Oh,
North Carolina, North
that's
Carolina. There were
okay.
only 40. So I moved from the Raleigh area to the Charlotte area,
Okay.
and didn't know anybody. I didn't go to any of the dietetic meetings. I was like, I had to start the ground up. And this is kind of what I want to forward to your younger NDTRs. Get out there and cold call if you have to. So I got there. I got liability insurance. I started talking to the dietitian at the hospital. I had taught diabetes management at the hospital I was last at, had experience. I said, can I volunteer 1 hour to teach diabetes management for you? And she was like, yeah. And I started that. And that's what led me to be the YMCA. I just got my name around, my card. That's before everybody had websites. And I got the YMCA, 2 YMCAs in the greater Charlotte area. Davison, guy from Davison called me for a research project I worked with. And then I worked for a couple of private doctors. They would just say, come in, we've got this gluten-free diet. We would like you to go over with this person. And it just started, it kind of snowballed into a great, I thought, career for me. But I also knew, I'd have to have liability insurance, and I would have to have a support dietitian, which I did find. And they were the ones that if you felt like you were above your scope of practice, you sent them an email, told them what you're going to do, and they either approved it or did not. And I went by all the regulations you have to do to make sure I could move forward with it. And I loved it. I did it for 7, 8, 9, I can't remember how many years, but I enjoyed it. And then I moved back to the Raleigh area, and I went back into public health. So I have been a public health nutritionist now for 20 years. And I did the Nutrition to Eat Well. That is my side gig, and I love doing that. I kind of look at that as concierge nutrition for people. I make it really personalized for them. I'm like their coach, what they're having problems with, and just everything they need to make it fun and make it something they're not going to leave, a new way of eating, not a diet or nutrition plan, just a changing their way of eating. So that's what I like doing.
That was so much amazing things that you did. So you were working, so you needed the liability insurance and you needed a dietitian. So were you a contract DTR, would you say, at that time? Or
yeah, I guess so. Yeah, I was. But I kind of did everything I wanted to do. I planned out my time, which was wonderful. Like when my child would have fall break, I just said, I'm not seeing anybody. I'm not doing anything on this week. It gives you a lot of flexibility. I will say that. And just the Charlotte area was really different for me because I had a lot of clients in the NASCAR area, and I never did anything about NASCAR. And all the work is in the pits, and you got to keep those pits guys healthy and well. So I worked with a lot of racing teams. I know that seems really kind of crazy, but I did, and I enjoyed it and learned a lot about racing, which I did not know.
Yeah, that's an interesting niche. What nutrition do NASCAR drivers or pit drivers?
It depends on the guys in the pits who is having the issues with whether it be cholesterol or any of their issues. You just want them to eat healthy. I mean, because it is a sport. People don't look at it, but when they have to go and change things really quick, they got to be quick. So it was just an interesting thing to pick up there, and something. It was unusual, put it that way.
Yeah.
I tell everybody I've worked with a lot of people because of patient confidentiality. I can't tell you, but they would be amazed to know. They'd be amazed to know.
I believe it.
Especially being here in the South, they would be like, wow. So it was interesting. I enjoyed it.
That's so great. And so at the YMCA, what were you doing? What were you doing there?
I did a lot of weight loss, but people would come to me with other things they had, diabetes or high cholesterol, or some vegetarians with vitamin deficiencies. But mainly I would have to say weight loss. Everybody's wanting to get the weight off, and the YMCA would have this jumpstart program and would pair me with a physical trainer to get you like on a plan. And that was really big at the time. It was really big. People loved that. You paid a certain fee and you got kind of help through it to get through your spot where you needed to be. And I enjoyed that. And it gave me a membership, free memberships. I could go work out if I wanted to. So that was kind of nice.
Yeah, that is nice. And you also mentioned research. You were part of a research. So you have to
Yes,
elaborate on
actually.
that. Give us the detail.
Yes. And that's one of my clients at the YMCA was talking to a professor at Davidson, and they said, well, we need a nutritionist through this research project. And Duke and Davidson are both Methodist universities, and they both got a grant, and it was to help Methodist ministers deal with stress. And so they had a spiritual counselor, a physical person, PT trainer, nutritionist, and I can't remember who the other one was. Maybe it was the nurse or something, but it was all to give them a refresher. It was a week refresher and get to their core problems and find out what they needed to tweak. I did not realize that people in the ministry are the most stressed people out there. And you would think that wouldn't be so, but it is. They have to go through a lot, and they're dealing with family problems and potluck dinners that they always have to eat or they hurt somebody's feelings. And I learned a lot about that too. I mean, wow, that there was so much stress on them, but it helped get data for Davidson and Duke. And I'm sure they used it well. That was like a 2-year, I think, endowment. It was very interesting, to say the least.
Yeah, so you had community, you had research, and then you mentioned that you were also in doctor's offices.
Yes.
So
yes.
Was that a similar way of getting in with just word of mouth, or how did you manage to get into doctor's offices?
Well, it kind of started with my own personal doctor. She knew what I did, and she said, you could really help me coming by here one day a week. And it started with her, and she referred me to somebody else. Word of mouth is a beautiful thing. She referred me out to some other doctors she knew, and pretty soon I was seeing patients 1 day or 2 days a month at that person's office. They put me a little room in the back, and I went over everything with them, whether it be, gluten-free, food allergy, whatever they thought they needed to talk to me about.
Yeah.
So that was interesting. The only bad thing about it is it seems like sometimes I was traveling all the time, like going from here to there, traveling a lot. So, but I learned how to manage my time better. When you first do it, you feel like you're just on the go all the time, but then you start managing things a little bit better.
So how did you learn to manage, or like looking back, or what would you tell somebody who wants to do something as elaborate as you with all these jobs to manage all of that?
I would tell them, like I tell my patients, to look at the week ahead of you, because you got to plan that week. Like I tell patients when I'm seeing them, if you know your kid has violin practice on Wednesday night and you're not going to cook a hot meal, plan for a healthy sandwich or something like that. That's the way I would plan my week. So I'm not burning up gas all up and down the road. So I would schedule, if it was with a certain doctor, I would tell their assistant to put everybody on that day. And I do the same with the research I came in, and the same with the Y. At first, I just was so happy to be having all this business that it was great. But then it started getting to where I had to get control of it. And that's a good feeling too, organizing. So, yeah. But that was the hardest part. But once I got that solved, it was okay. I got everything together then.
Yeah. That's a good advice, just to like take time and figure it out and plan the week ahead.
Mm-hmm. Yeah.
So you mentioned that you had the RD over you when you needed to go out, when you were outside of your scope. Do you have any example where that you had to utilize that resource, or you had to stop from going outside of your scope?
I'm trying to think. I not a lot of occasions, but when I would email her, she would say, that's absolutely correct. She would say, don't just send her it. Send her it. What is your plan? and I would send the plan, and she would say, that's absolutely right. I've worked with a lot of great dietitians, a lot. They have been put in my path, and they make a big difference of how you react and know and learn from. That is a huge deal. Because I've learned something from every one of them, every single one of them. And if you're working for somebody you're not learning something from, they need to rethink that job. So sorry, my phone was ringing.
Oh no, you're fine. That's good. Always look for those opportunities to learn and to grow.
Sorry.
And so you left all of the jobs you were doing and you went back to public health. So what was that transition like for you?
It was a good change. I like public health. I love public health. So it was just flowing right back into it. And when you get my age, you start thinking about retirement, and state retirement is very good. And so now I got the best of both worlds. I've been 20 years. I could retire right now if I want to, which I do not. Or I could keep on doing the private practice thing that I'm doing and do both, or do something else, or go back to hospitals. I've thought about going back to hospitals too. So I'm at the point now that I'm having fun with it. I'm just doing what I want to do. I was very fortunate on one of my friends in Australia. I was helping her with her diet, and that led to a couple of people. And I'm thinking, this is just weird, talking to people from Australia about their diet and learning things. I've been in many different countries, and they're all so different. And the food is so different, and the way people eat are so different. And I really enjoy that. Going back to public health was something I knew and I enjoyed. I enjoy helping people. I like being part of the WIC program and then doing outpatient. I've always liked that. I liked it before, but you do get where you want to try different things. So I guess I got burnt out. I got to have the pleasure of doing other things. I'm coming back to public health, not minding it at all. I have worked with great people here. And then having my website to do what I want to do, to meet people. And, like last year when I went to what was it last year? It was COVID, in the Washington, D.C., Fancy. Have you ever been to Fancy?
Yes.
I loved it. And I was just, put my card out there and met a whole lot of great people. And it was just I've never been to national. So it was just so much fun. And I learned a lot from it, a whole lot from it. So
with your current public health job, what does that entail?
I work for the Women's Infants and Children's Program, and I do some outpatient. It depends on what it is exactly, and there's a few things I won't do. Like I don't do people that have had like lap band, because that's just not an area I want to go into. I love diabetes. I just have always loved it. Both my parents were diabetic. I like trying different diets for my patients, because that way I know a lot of nutritionists do not try a diabetic diet, or they don't try a gluten-free diet. So they have no idea what they're telling the patient to do. But when I'm telling people to total up your carbs, we're creatures of habit. You only have, milk's 12 carbs, or you'll know it. At first they're overwhelmed being a diabetic. I like seeing a diabetic personalize what they're going through and then helping them through that. That gives me immense pleasure to do that. Because like I said, both my parents were diabetic, and probably I didn't watch my diet. I may be in that category too. Mm-hmm. So it's very important to me. Diabetics and weight loss are probably my favorites, I have to say.
And those are very, very important for the way that the nation's going with obesity and raising diabetes rates. So it's great that is like what you're good at. Yeah. So then you also have your private practice you mentioned. So when did you, I feel like you've always kind of been doing that with getting your insurance right when you came out, but when did you officially start the online platform and getting clients for that?
I'm thinking it was about 3 years ago. I thought I was getting getting the itch to do a little something else, but didn't know exactly what I wanted to do. I knew I'd be in public health for at least 20 years, which, like I said, I'm coming on my 20th year with the state here. And I went to somebody to do my site, and they did they did absolutely bang up job on my site, and started getting some hits. Like I said, you have to get out there because people need to know what you're doing to contact you. And then you get your cards and you just get yourself out there. And a lot of mine have been, believe it or not from the state I'm in, and a lot of it for different other places, which, like I said, I love. I love getting out of the country, people. It's just fun for me, just because you go from public health and WIC, and then you talk to them in the afternoon, and it's totally different what's going on with them. And so it's nice. And most of them need a more or less a coach, a coach. And I look at myself like that, like to talk to them, spur them on, make sure they're feeling good about the changes they've made. And I had one, I always tell them to get back with me in a week. And I didn't hear back from her. And she goes, "Oh my God, I hated you so bad." And then I got used to my diet. And I felt so much better. And now I'm ready to talk to you again. But she at least admitted that she felt bad. So, I mean, a lot of people won't even admit, when you go from high carbs and you have to moderate them, or sugar, you have to moderate it, your body's in shock. And they just won't tell you. But I like people that are honest with me, because I take it, I laugh, I'm sarcastic with it, and joke, and it's all good. It's all good. I want to make them feel good. And I try to personalize it. I even had a pilot that couldn't do without his Pringles. And he said, "I got to have my Pringles." And I said, "Let's measure it out, put them in a Ziploc bag, and, find out what is it they cannot live without." Because if you tell them they can't have that, that's not going to happen. That's not going to happen. We got to figure out how to moderate it.
Yeah, meeting them where they are. That's a very important theme I hear coming up a lot with NDTRs who are doing private practice. And it's interesting, you mentioned that you talk to people all over the world. And so that definitely spikes my interest. And I have to ask, how do you deal with the different way people eat and the diversity? Because people eat so differently just from state to state. And you're talking to people who aren't even in the United States. So how do you handle that?
Well, I've learned a lot from it. And I kind of know. And if I don't know, I ask. Like I said, I've been to Europe, a lot of different places. My best friend's in France. They don't hardly do anything processed there. They have bread and cheese like every day, water, nothing fast food. They eat perfectly, to me. And then you get people like Ireland that are meat and potatoes, no diet food. And it's interesting. Even going to the islands, we went to St. Martin, or maybe it was Antigua, but they do just very unique soups and beet soup, and just all this stuff is so fabulous food. I love food. But it's neat to see what they do with it, how they eat every day. And, the islanders, fresh fruit. It's amazing how you feel. Well, I love vacationing in another country, because I feel so much better when I get home, because I've ate really good food and met really great people. And it's very interesting. But anything I don't know, I try to find out as much about it as I can, like not eating customary customs. And even in France, being prompt to your meal, you cannot say, "I'm going to be there at 6 and you are not there at 6. They take promptness, and you have to have an aperitif to stimulate your appetite. And that can be a little cookie, it can be a little pudding or whatever. And they take it seriously. The Europeans definitely look at food a lot different than Americans do. It's interesting. I like the customs.
Yeah, that's so fascinating to hear. Has that experience of traveling and understanding how different cultures are eating the food affected how you do your nutrition coaching with people here in the States?
Yeah, if it's a person from a different background. And I am fortunate. I work with the other nutritionist I'm with is from Jamaica, and she tells me all about the way they cook and do things there. And she's a vegetarian. And it's very interesting all the vegetarian dishes she makes, because I learned how to deal with all these. I'm always willing to hear a great vegetarian dish or a great diabetic snack. And a lot of things I've passed on to my clients or patients is something that I've learned from my client or a patient. And they've told me, oh, you try these, like ice cream sandwiches, 2 graham crackers, put some light cream whip, wrap it up in saran wrap, put it in the fridge, and it makes all the processed stuff. I mean, I just love learning some of the best stuff from my patients, just not reading about it, where their creative mind goes. And I always say, can I use that? Can I use that idea? Because they can come up with some good stuff. And it's always, like I said, it's always interesting how they can put things together and make it good.
Yeah, learning from the patients. That's definitely a good takeaway from this interview, to like listen and learn and not just be the expert in the room, but there's two.
And pass it on. And pass it on.
Yes. Yeah.
And that's everything from like, I have breastfeeding mothers. I breastfed for a year. I know all about it, but I'm not the breastfeeding person here. And I've learned a lot of things, how to get the baby to wean, what's been successful and what's not been. And when I tell them, you have to watch your language. You can't, as we have to know where our scope of practice is. You can't diagnose, but you have to say, I heard from another patient or client that they tried this. And you're not really telling them to do it. You're just saying you heard it from somebody else at work. And they'll turn right back around and say, oh my gosh, that worked perfect. Or, that was it. And that I love here, because I always say, give me the feedback. Did it work or not? And that's the big thing.
Yes. And I feel like that speaks to experience and the importance of experience and working, because you can read so much, but once you like see results and talk to patients and are able to have that communication, it really allows you to like, oh, this patient had this situation, maybe this will work for this. And as you said, suggest it or say, I've heard, and do it in a way that's not like you're telling them something else, something inappropriate, but experience is just so important. Yeah.
And it is different in different hospitals too. When I taught diabetes management at one hospital, they recommended a little bit of cinnamon in the morning to maintain the blood sugars. But when I went to another hospital, they were like, no, you cannot say anything about that. So each hospital is different too. If what they promote or want you to say, or how they want you to say it when you're teaching diabetes management. That I found really interesting too.
Yeah, that is interesting. So kind of on that topic, because we're getting into like kind of research and whatnot, how do you stay up to date with all of the different fields you're working in nutrition? How do you keep evidence-based nutrition in your counseling and coaching sessions?
I read a lot of the journals that we get from ADA. I do. And the web, I keep up with a lot of that stuff. And whatever's the fad diet, I keep up with it, because you better believe somebody's going to ask me, whether it be keto or South Beach or whatever is the flavor of the month. I need to know exactly what it is and how to talk to my clients about it. And I recommend all nutritionists do that, because more than likely they're going to be asked about that. And everybody knows as a nutritionist, once you say you're a nutritionist, everybody asks you something about, is Kool-Aid that bad or whatever they ask. And it's just the part of being it, but especially the fad diets. The fad diets are the biggest thing that I get asked about. What do you think about blah, blah, blah?
Yes. So how do you respond? How do you respond to those questions? Because a lot of times I find when I'm asked that question, they don't really want to listen. They want to hear yes or no. So how do you handle those questions?
I don't make it black and white. I kind of say, I say this a lot to my patients, no matter what diet you're talking about, whether it be diabetic, cardiac health, whether it be prenatal health, a healthy diet is a healthy diet is a healthy diet. I mean, once you get one, diabetes, the chance of you getting heart disease or hypertension is high. So you need to encompass all of it together and go with it, the healthy diet. And I do suggest moderate carbs most of the time, because I find that most Americans eat too much meat, saturated meat especially, and they eat a little bit too many carbs. And so I always suggest that and try to reel it in like that. Like, that's a healthy diet. You don't need to do Atkins, but we need to maybe moderate those carbs and just kind of see how they progress. And they tell me usually.
That's good to have that clear communication with your clients. So I want to hear your perspective on this, because I feel like it'll be interesting. When you started off your career, there wasn't a lot of websites, Instagram, social media, and you were doing a lot of networking. And now, then you also now have a website, so you're also doing networking online. So what are the parallels, and what things remain consistent in networking through having internet and not having internet?
Well, I was always on the internet, but
Sorry,
I only had the I only had the email. I didn't have the web. And I would tell them, oh, I check it first thing in the morning, then I'm gone the day, and check it at when I get back. The constant communication is good. And I always tell them, so I'm not bombarded with a whole bunch of questions. Think about your questions, write them down, and email them to me. Because sometimes they'll send one question about olives or something really strange, and then they'll ask another question. You can tell their minds just after they hear a diet, they're like, what? So I say, you're a little bit overwhelmed, write your questions down and send me an email, and I'll address every single one of them. And so that kind of helps. It organizes my time, it organizes their time, because I know not a lot of people like to see a nutritionist, because we're going to kind of tell you what to eat. If you notice that, we're kind of like, not everybody's favorite person, but sometimes, because we got to tell you what you got to moderate, and nobody likes hearing that. I mean, I don't. So that is, I think, the biggest deal. And when I was going through nutrition and dietetics, there was only one psychology course 101. Now, I don't know if they've improved that, but I remember when I was on the board of North Carolina Dietetics, I said there needs to be, instead of just the diet therapy we take and psychology 101, more of a counseling, because we have to deal with so many psychological things that people do not realize. And I'm saying it from the person who is high up the socioeconomic ladder, and then low too. There's different issues they're all dealing with. Like, I cannot talk to a lady about getting her hematocrit up when she doesn't have a working stove. Do you know what I'm saying?
Yeah.
We got to try to get a social worker in here. We've got to try to address those problems, and then get to, your hematocrit's low, and these are the things we're going to do to bring it up. That's why, right when I address my clients, I always say, okay, what's going on in your life right now? How is everything, before you start on one thing? Because you never know what's going on with that person. And I like to find out first before you start the counseling. And I really wish that they had a specific psychology course for nutritionists to deal with comfort food issues, to deal with, just all these mental things that, we're not talking like anorexia or bulimia. They need to see a psychologist before they come to us anyway. But I'm just saying, food is so much part of our mental, just dealing with it all. So, but it does make a big difference. It does with getting to the patients, but it is personalizing it with that person. I think no matter whether you have a lot of web, social media or whatever, or you have none, to personalize it as much as you can. I think that helps. And tell them you've done it. Like, I've done a diabetic diet. I can tell you how many carbs are in, like I said, the meal for your bread or your whatever. I've done it. I think that helps when they know that. Because they don't feel like it's like your doctor's telling you to lose weight and they're big. They don't, your cred's you want to keep your credibility and your cred as a nutritionist. And I think that's really important. And to have compassion and to try to understand where they're coming from. And when you don't understand, ask them to please explain it to you so you can understand. I think that matters a lot.
Yeah, that's a lot of helpful things there. So being confident in knowledge that you have, asking them how they are doing, which that is such a good approach to starting something, building that rapport by just having them, how are you doing? Thank you for that. And then asking them questions for clarity.
Yeah. Oh yeah.
Yeah.
And yeah. And sometimes they have had a bad day, or you've got to get through that before you can get into your session, because sometimes they just need somebody to talk to.
Yes.
And I see that more with WIC than anything else, because the moms have been with the babies all day and they really want some adult conversation.
Yeah.
So I have to kind of, get them back on track sometimes, because they just want to tell a little bit too much of how their day is going. And that can be kind of funny, but we redirect a lot, redirect.
Yeah. So finding,
and a lot with my elderly too. You have to redirect. They talk, they want to get onto certain things, and you just have to redirect gently and nicely. But just redirect it, and it's fun. I wouldn't have went into nutrition if it wasn't you're being with people. The people is what makes it fun.
Yeah.
Learning all about the people and their lives, and you get regulars and you know about them, and it's fun. And you actually feel like you're helping people, whether it being, oh, I got the last 20 pounds, or I'm doing WIC and it's a Fair to Thrive, and they made it right at that point they should be. And we're like, woo, that's the fun times. That's the good times.
Yeah. Seeing the results and the progress of your work.
That's what makes my job to me. I wouldn't have been in it. How long? Been 25 years. Ooh, I feel so old. 25 years if I hadn't. It's that's what's rewarding, helping people. And I tell anybody, if you don't want to help people and you're not a people person, this is not the job for you. This is not.
You have to be people oriented. So you mentioned earlier on in this interview that you are an Academy member. You've been a part of the Academy.
I have. And I got the biggest thing I'm proud of is recognized NDTR of the year. And I worked a lot with the board. They nominated me. I did a lot. That's why I like what you're doing with the Spotlight. I did a lot back in 2004, 2005, getting DTRs on the board, getting them noticed, getting more people to talk about it, getting more of them to go ahead and get that exam. I know it's hard. It was hard for me, and I had a 4-year degree and worked. It's hard. It's not easy. And that was my biggest thing, getting that award, I have to say.
Yeah, can you tell us a little bit more about that award? We had one NDTR on it who had it, I think, in 2017, but can you tell us your experience with that award?
I didn't even know I was nominated. I was nominated from somebody on the board because I tried so hard, and then they told me I got it, which was absolutely shocked. And I like the way that the ADA does it. They give you the award, you get it at the conference, but I was just shocked because, and I even have it here on my desk because I'm going to show you. The North Carolina dietetic gives you this one, the little clear one. Then I got one from the national, which I think is behind me somewhere. And then Charlotte sent me a little one. So it's like, once you're recognized for that year, you get 3 little things that are just really super nice. And it's with you for the rest of your life. I had no idea. And it was a big deal. It was a big deal to be recognized for work, especially being on the board and trying so hard to get NDTRs recognized. Big deal.
Mm-hmm. That is a huge deal. That is an awesome award, and congratulations on receiving it.
Thank you.
And when you were on the board, I'm curious, I would love to hear how you promoted that NDTR credential through the Academy.
Well, I remember talking to him and said, why don't you have a DTR representative? They said, because there's not that many. And that's when I got to find out there were only 40 in the state of North Carolina. And I just tried to promote it as much as I could, find out what we could do to promote it, if we could get some schools to do it. But a lot of the questions were, why aren't the people go through the studies and they just don't take the exam? That was their biggest thing. Why don't they finished the exam. And I said, I don't know. I think, like I said, I had a 4-year degree and I already did an internship, and it was not the easiest. I'm sure people have told you they've struggled with the anxiety of it all and taken it. I think a lot of it, they were scared. And if you could get more people to me with a credential, I think it would help, and people understanding the credential, it would help altogether things. And that was a big part, just letting them know that the NDTR and RD could work like tag teaming things. When I worked at hospitals, you get in there, you get the intake, the selected modified diets. You knew, okay, this is a renal patient. This goes to dietitian here, or whoever had their specialties, and they can do a lot of the prep work and do the stuff to get everything together to organize it all. And I think if more hospitals have them, it would be vital to get things more organized in places, everything on track. And they just didn't have a lot of that when I was working in hospitals.
Gotcha.
They didn't know what they could do with them, I guess. They did that. A lot of people think of diet, they're for trays or they don't know they can teach diabetes management. They don't know. I worked at Walmart Army Hospital as a college, in between college summers, and they would let me go. Somebody in the airborne broke his jaw on a parachute, do a dental soft diet to him, talk to him about it. I mean, a dietitian doesn't necessarily need to be doing that, but I could explain it quickly. And it's just that they can just use them so much on so many different areas.
Yeah.
And I just think a lot of people didn't know that. They just, I don't know. But I think now it's got, and I have taken the preceptor study for the dietetic internship, but the RD I work with does all the dietetic interns. But I just learning to be a preceptor or getting that certificate is a lot there, because it does help you. To me, every little thing you can learn helps you somewhere along the way to help. And I feel like I'm getting, in the closer to, I don't want to say retirement, but kind of retirement, that I'm like, I can relax a little bit. I want to help any of them coming up to know what they can do. And all the availability is out there. And if people don't know what it is, do like I do. Go to the hospital, present yourself. Say, like, I've got this credential, I have liability insurance, I can do X, Y, Z, and you got to do it. But I still find they're still doing it now. It's still a work in progress, but it's getting better.
Yeah.
Like, you don't have to do the whole internship now. You can just take the exam, and that's I think good.
Yeah.
And then that way you can decide if you want to stay there or you want to do the RD.
Yeah. So thank you for all that you've done for and are doing for DTRs, because I know that's definitely helped current DTRs now, the work that you've done and the award that you've received and all of that. And so you've given already so much great advice, but is there any key takeaway that you want to leave with the NDTR audience about being a DTR?
Like I said, don't be afraid to just knock on somebody's door or to volunteer. And a lot of college kids don't really like to volunteer their time right now. I don't understand. Like I said, I worked at an Army hospital every summer and waited tables at night. So my summers were not like all at the beach. So, and it was getting almost a year experience when I graduated. Take that internship, I'll teach diabetes management, volunteer, because that will help you, number one, get experience, and then get you to form relationships that can be amazing and help you later on down the road.
Yeah. Building relationships, putting yourself out there, and being okay with volunteering your time, which we hear that all the time as students, but that's good to hear that reiterated. And so how can people find you?
The best way is my website, nutritiontoeatwell. Any concerns, questions, whatever, they can reach out to me there.
Okay, well, thank you so much for your time. I hope everyone took a lot of great information off. Make sure you check out her website just to see what she's doing, and we will see you in the next interview. Have a great day.